Question 1. What factors determine the extent to which a healthcare provider must adapt its operational and financial strategies to comply with federal and state mandates aimed at managing and controlling health care costs? Option A. The availability of new technologies that promise cost reductions, regardless of their regulatory implications. Option B. The subjective interpretation of cost-saving opportunities by the organization's executive leadership. Option C. The overall economic climate and the general pressure to reduce healthcare expenditures across the industry. Option D. The specific requirements of applicable federal and state mandates, the potential financial penalties for non-compliance, and the organization's current performance against mandated quality and cost metrics. The correct answer is D. The specific requirements of applicable federal and state mandates, the potential financial penalties for non-compliance, and the organization's current performance against mandated quality and cost metrics. Explanation. This scenario is professionally challenging because healthcare organizations operate within a complex web of federal and state mandates designed to control costs and ensure quality. Navigating these regulations requires a nuanced understanding of their specific requirements, potential penalties for non-compliance, and the interplay between different legal frameworks. A failure to accurately assess the impact of these mandates can lead to significant financial penalties, reputational damage, and compromised patient care. Careful judgment is required to prioritize compliance efforts and allocate resources effectively. The correct approach involves a comprehensive assessment of how specific mandates, such as those related to quality reporting, value-based purchasing, and patient protection, directly influence operational strategies and financial performance. This includes understanding the reporting requirements, data submission deadlines, and the potential financial incentives or penalties tied to performance metrics. Regulatory justification stems from the fundamental principle of adhering to all applicable laws and guidelines to avoid sanctions and maintain operational integrity. Ethically, this approach aligns with the responsibility to operate transparently and in accordance with established standards. An incorrect approach that focuses solely on cost reduction without considering the regulatory implications overlooks the mandates that often link cost control to quality outcomes. This can lead to decisions that inadvertently violate regulations, such as cutting corners on necessary patient services or failing to implement required quality improvement initiatives, resulting in penalties. Another incorrect approach that prioritizes only immediate financial gains without a thorough understanding of long-term compliance obligations risks future non-compliance issues. This can lead to a reactive rather than proactive compliance strategy, which is often more costly and disruptive. A third incorrect approach that relies on outdated or incomplete regulatory knowledge fails to account for evolving legal landscapes and can lead to significant compliance gaps. Professionals should employ a decision-making framework that begins with identifying all relevant federal and state healthcare cost control mandates. This should be followed by a detailed analysis of each mandate's specific requirements and potential impact on the organization's operations and finances. Prioritization should be based on the severity of potential penalties and the strategic importance of compliance. Continuous monitoring of regulatory changes and seeking expert legal and compliance counsel are crucial components of this process. Question 2. Examination of the data shows that a health plan is considering shifting its provider reimbursement strategy from a traditional fee-for-service model to a capitation-based system. The primary objective is to control escalating healthcare expenditures while maintaining or improving the quality of care delivered to its members. Which of the following reimbursement strategies best aligns with the regulatory intent of managing and controlling healthcare costs in this context? Option A. Implementing a capitation model where providers receive a fixed monthly payment per member with adjustments for age, gender, and health status, and are held accountable for quality outcomes. Option B. Transitioning to a capitation model with a fixed payment per member without any risk adjustment or quality performance metrics. Option C. Adopting a hybrid model that primarily uses fee-for-service but includes a small bonus for meeting certain utilization targets. Option D. Continuing with a fee-for-service model, focusing on negotiating lower reimbursement rates for individual services to reduce overall expenditure. The correct answer is A. Implementing a capitation model where providers receive a fixed monthly payment per member with adjustments for age, gender, and health status, and are held accountable for quality outcomes. Explanation: this scenario presents a professional challenge because healthcare organizations are constantly seeking to balance cost containment with quality of care. The choice between fee-for-service and capitation models for provider reimbursement has significant implications for how healthcare services are delivered and financed. A deep understanding of the regulatory framework governing these incentives is crucial to ensure compliance and ethical practice. The correct approach involves recognizing that while fee-for-service can incentivize volume, it may lead to overutilization and increased costs. Capitation, on the other hand, incentivizes efficiency and preventive care by providing a fixed payment per patient, regardless of the services rendered. This model aligns better with the goals of managing and controlling healthcare costs by encouraging providers to keep patients healthy and avoid unnecessary procedures. Regulatory guidance often favors models that promote value and cost-effectiveness, and capitation, when properly structured and monitored, can achieve this. An incorrect approach would be to solely focus on fee-for-service without considering its potential for driving up costs. This fails to align with the overarching objective of managing and controlling healthcare costs, as it can lead to a volume-driven system that may not be the most efficient or effective for patient outcomes. Another incorrect approach would be to implement capitation without adequate risk adjustment or quality metrics. This could lead to providers avoiding sicker patients or cutting corners on necessary care to maximize profit, which is ethically problematic and may violate regulations designed to protect patient well-being and ensure equitable access to care. Professionals should approach this decision by first understanding the specific regulatory environment and its stance on provider incentives. They should then analyze the potential impact of each model on cost, quality, and patient access. A thorough risk assessment for capitation, including consideration of patient demographics and disease prevalence, is essential. Ultimately, the decision should be guided by a commitment to both fiscal responsibility and the delivery of high-quality, patient-centered care within the bounds of applicable regulations. Question 3. When evaluating proposed negotiated provider discounts and bundled payment arrangements for a health plan operating under U.S. federal and state healthcare laws, which approach best ensures both cost containment and regulatory compliance while safeguarding patient care quality? Option A. Prioritize accepting discounts and bundled payment proposals that offer the largest immediate percentage reduction in claims costs, assuming these reflect genuine efficiencies and are compliant. Option B. Implement a rigorous review process that assesses the reasonableness of discounts based on documented cost savings or efficiencies, ensures bundled payments incentivize value-based care and quality outcomes, and verifies compliance with all applicable federal and state healthcare regulations, including anti-kickback and self-referral laws. Option C. Accept provider discount proposals that are presented as standard industry practice without independent verification, and implement bundled payment models based on historical utilization data without considering potential impacts on care delivery. Option D. Focus on negotiating bundled payment models that consolidate services into a single payment, regardless of the specific services included, to simplify administration and achieve predictable costs. Correct answer is A. Prioritize accepting discounts and bundled payment proposals that offer the largest immediate percentage reduction in claims costs, assuming these reflect genuine efficiencies and are compliant. Explanation: this scenario is professionally challenging because it requires balancing the financial interests of a health plan with the need to ensure access to quality care for its members, all within the confines of U.S. federal and state healthcare regulations. Negotiating provider discounts and implementing bundled payment models are key strategies for cost containment, but they must be executed in a way that does not violate anti-kickback statutes, Stark law, or antitrust regulations, nor compromise patient care quality or access. Careful judgment is required to ensure that contractual terms are fair, transparent, and compliant, avoiding any arrangements that could be construed as steering patients or unduly influencing physician behavior. The correct approach involves a thorough review of proposed negotiated provider discounts and bundled payment arrangements to ensure they align with the plan's fiduciary responsibilities and regulatory obligations. This includes verifying that discounts are based on legitimate cost savings or efficiencies, that bundled payments are structured to incentivize value-based care rather than simply volume, and that all contracts are clearly defined and adhere to federal and state laws governing healthcare provider relationships and payment methodologies. Specifically, such an approach would ensure compliance with the Medicare Anti-Kickback Statute, ACTS, by ensuring that any remuneration exchange between the plan and providers is for legitimate services and not an inducement for referrals, and with the physician self-referral law, Stark Law, by ensuring that financial relationships between physicians and entities furnishing designated health services do not violate prohibitions on self-referral. Furthermore, it would consider antitrust implications to prevent monopolistic practices or unreasonable restraints on trade within the healthcare market. An incorrect approach would be to accept provider discount proposals solely based on the immediate reduction in claims costs, without a deeper analysis of their underlying justification or potential regulatory risks. This could lead to arrangements that, while appearing cost-effective on the surface, may violate the AKS if the discount is disproportionately large and could be interpreted as an inducement for referrals. Another incorrect approach would be to implement bundled payment models that inadvertently create financial incentives for providers to limit medically necessary care to stay within the bundle's budget, potentially violating ethical obligations to patients and leading to quality of care issues. Furthermore, failing to conduct due diligence on the financial viability and operational capacity of providers participating in bundled payment arrangements could expose the plan to financial risk and negatively impact member access to services. The professional decision-making process for similar situations should involve a multidisciplinary team including legal counsel, compliance officers, contracting specialists, and clinical leaders. This team should establish clear criteria for evaluating discount proposals and bundled payment models, focusing on fair market value, demonstrable efficiencies, and robust quality metrics. A risk assessment framework should be employed to identify potential AKS, Stark Law, and antitrust violations, as well as operational and quality risks. Contractual terms should be meticulously drafted to ensure transparency, define performance expectations, and include provisions for dispute resolution and compliance monitoring. Regular audits and reviews of implemented arrangements are crucial to ensure ongoing compliance and effectiveness. Question 4. The risk matrix shows a significant projected increase in the proportion of members aged 65 and over within the next decade, coupled with a slight decline in the birth rate. As a health plan administrator, you are tasked with developing a strategy to manage the associated financial pressures. Which of the following approaches best aligns with regulatory requirements and ethical obligations for managing healthcare costs in this demographic context? Option A. Proactively develop and implement strategies that address the financial implications of an aging population while ensuring continued access to necessary care, including exploring innovative care models and promoting preventative health. Option B. Delay any significant strategic changes, assuming current premium structures will remain sufficient to cover projected cost increases due to the aging demographic. Option C. Implement immediate and substantial reductions in coverage for common age-related chronic conditions to offset anticipated cost escalations. Option D. Focus exclusively on significant premium increases across all member segments without exploring alternative cost containment measures or benefit adjustments. The correct answer is A. Proactively develop and implement strategies that address the financial implications of an aging population while ensuring continued access to necessary care, including exploring innovative care models and promoting preventative health. Explanation. This scenario presents a professional challenge because it requires balancing the financial sustainability of a health insurance plan with the ethical imperative to provide equitable access to care, particularly for a growing demographic with potentially higher healthcare needs. The aging population, a key demographic factor, is associated with increased chronic conditions and utilization of services, placing upward pressure on costs. Simultaneously, declining birth rates can impact the long-term contributor base for the plan. Navigating these demographic shifts demands careful consideration of regulatory requirements and ethical principles governing health insurance. The correct approach involves proactively developing and implementing strategies that address the financial implications of an aging population while ensuring continued access to necessary care. This includes exploring innovative care models, promoting preventative health measures, and potentially adjusting benefit designs or contribution structures in a transparent and compliant manner. Regulatory frameworks, such as those governing health insurance solvency and consumer protection, mandate that plans remain financially sound to meet their obligations. Ethically, plans have a responsibility to their members to provide access to care and to manage costs responsibly to ensure long-term viability. This approach prioritizes a sustainable and equitable future for the plan and its members. An incorrect approach would be to ignore the demographic trends and their cost implications, leading to potential underfunding and an inability to meet future claims. This could result in a regulatory crisis, where the plan fails to meet solvency requirements, leading to intervention or even insolvency. Ethically, this inaction would be a failure to prudently manage the plan, jeopardizing the financial security of its members and their access to care. Another incorrect approach would be to implement drastic cost-cutting measures that disproportionately impact the aging population, such as severely limiting coverage for age-related conditions or imposing prohibitive premium increases without adequate justification or regulatory approval. This would be ethically unsound, as it targets a vulnerable demographic and could be seen as discriminatory. It would also likely violate consumer protection regulations that prohibit unfair or deceptive practices. A third incorrect approach would be to focus solely on increasing premiums without exploring cost containment strategies or value-based care initiatives. While premium adjustments may be necessary, an exclusive reliance on this without addressing the underlying cost drivers associated with demographic shifts would be an incomplete and potentially unsustainable solution. It could also lead to adverse selection, where healthier individuals opt out, further exacerbating the cost burden on the remaining members, and may be subject to regulatory scrutiny if deemed unreasonable. Professionals should employ a decision-making framework that begins with a thorough analysis of demographic data and its projected impact on healthcare utilization and costs. This should be followed by an assessment of current benefit structures and financial reserves. The next step involves identifying and evaluating potential strategies for cost management and revenue enhancement, considering their ethical implications and regulatory compliance. Finally, a robust communication plan should be developed to transparently inform stakeholders about the challenges and proposed solutions, ensuring adherence to all applicable laws and ethical standards. Question 5. System analysis indicates that a healthcare provider client is seeking to maximize reimbursement under recent Medicare reform initiatives, specifically concerning the transition to value-based payment models and updated eligibility criteria for certain programs. The client has proposed a strategy that, while potentially increasing their revenue, appears to stretch the interpretation of the new regulations regarding patient acuity and service necessity. As a compliance consultant, what is the most ethically and legally sound approach to advising this client? Option A. Inform the client that Medicare reform is complex and that they should proceed with their own interpretation of the rules, as the consultant cannot provide definitive guidance on such evolving areas. Option B. Recommend the client proceed with their proposed strategy, emphasizing the potential for increased revenue and suggesting they can address any regulatory inquiries reactively if they arise. Option C. Advise the client on legitimate strategies to optimize their participation in new Medicare payment models and eligibility pathways, strictly adhering to all published CMS guidelines and regulations, and clearly explaining any potential risks associated with aggressive interpretations. Option D. Advise the client to focus solely on traditional fee-for-service models, as the new value-based payment models and eligibility changes are too uncertain and risky to pursue. The correct answer is C. Advise the client on legitimate strategies to optimize their participation in new Medicare payment models and eligibility pathways, strictly adhering to all published CMS guidelines and regulations, and clearly explaining any potential risks associated with aggressive interpretations. Explanation. This scenario presents a professional challenge because it requires balancing the fiduciary duty to a client with the ethical imperative to adhere to Medicare regulations, specifically concerning payment models and eligibility. The pressure to maximize client benefits, while potentially understandable from a business perspective, must be strictly governed by legal and regulatory frameworks. Misinterpreting or misapplying Medicare reform provisions can lead to significant financial penalties, reputational damage, and harm to beneficiaries. Careful judgment is required to ensure that all actions are compliant and ethically sound, prioritizing patient well-being and regulatory integrity over potential short-term gains. The correct approach involves a thorough understanding of current Medicare reform initiatives, particularly those related to payment models and eligibility criteria, and applying this knowledge to advise the client accurately and ethically. This means identifying opportunities for clients to benefit from legitimate program changes, while strictly avoiding any actions that could be construed as fraudulent, misleading, or non-compliant with Medicare's rules. Specifically, it requires a commitment to educating the client on the nuances of new payment models and eligibility requirements, ensuring they understand what is permissible and what is not, and guiding them toward compliance strategies. This approach upholds the ethical obligation to act in the client's best interest within the bounds of the law and regulatory guidance. An incorrect approach would be to advise the client to exploit perceived loopholes or ambiguities in Medicare reform without a clear regulatory basis. This could involve misrepresenting a service to qualify for a new payment model, or encouraging the client to enroll in a program for which they are not genuinely eligible, based on a speculative or aggressive interpretation of the rules. Such actions would violate Medicare's anti-fraud and abuse provisions and potentially lead to severe penalties. Another incorrect approach would be to ignore or downplay the implications of Medicare reform, failing to inform the client of changes that could impact their eligibility or reimbursement, thereby failing in the duty to provide competent and up-to-date advice. This omission could lead to the client inadvertently becoming non-compliant. The professional decision-making process for similar situations should begin with a comprehensive review of the relevant Medicare reform legislation, regulations, and guidance from the Centers for Medicare and Medicaid Services, CMS. This should be followed by an assessment of how these changes specifically impact the client's situation. Consultation with legal counsel or compliance experts specializing in healthcare law is crucial when there is any uncertainty. The professional must then clearly communicate the compliant options and their implications to the client, ensuring the client understands the risks and benefits of each path. Transparency and a commitment to regulatory adherence should guide all recommendations. Question 6. Regulatory review indicates that a healthcare organization is seeking to optimize its demand management strategies to control rising healthcare costs. The organization is considering several approaches to enhance wellness programs and health education. Which of the following approaches best aligns with the principles of effective demand management and regulatory compliance within the U.S. healthcare framework? Option A. Implement a multifaceted strategy that includes comprehensive health education campaigns, promotion of preventative screenings, voluntary wellness challenges with modest, non-discriminatory incentives, and resources for chronic disease management, ensuring all programs are accessible and do not penalize individuals based on health status. Option B. Focus exclusively on offering significant financial incentives for employees to achieve specific biometric targets, such as weight loss or blood pressure reduction, with penalties for those who do not meet these targets within a defined time frame. Option C. Mandate participation in a series of online health modules for all employees, with a substantial financial penalty applied to their health insurance premiums for non-completion. Option D. Outsource all wellness program design and implementation to external vendors, relying solely on their recommendations, without internal review or integration into the organization's broader health benefits strategy. The correct answer is A. Implement a multifaceted strategy that includes comprehensive health education campaigns, promotion of preventative screenings, voluntary wellness challenges with modest, non-discriminatory incentives, and resources for chronic disease management, ensuring all programs are accessible and do not penalize individuals based on health status. Explanation. This scenario is professionally challenging because it requires balancing the strategic goal of improving employee health and reducing healthcare costs with the ethical imperative of ensuring that wellness programs are designed and implemented in a way that is fair, accessible, and does not inadvertently create barriers or disadvantages for certain employee groups. The CEBS exam focuses on managing and controlling healthcare costs within a specific regulatory framework, which in this case, for the purpose of this question, we will assume is the United States. Therefore, any approach must align with relevant U.S. federal laws and guidelines governing health and wellness programs, such as the Affordable Care Act, ACA, and the Americans with Disabilities Act, ADA. The correct approach involves a comprehensive strategy that integrates various demand management techniques, emphasizing education and proactive health measures, while ensuring compliance with regulations. This approach is correct because it aligns with the principles of responsible healthcare cost management by focusing on preventative care and employee engagement. Specifically, it acknowledges that effective demand management requires a multifaceted strategy that addresses both individual health behaviors and the broader organizational culture. By incorporating health education, promoting preventative screenings, and offering resources for chronic disease management, organizations can empower employees to make healthier choices, thereby reducing the incidence of costly acute and chronic conditions. Furthermore, ensuring that these programs are voluntary and do not discriminate based on health status is crucial for regulatory compliance under laws like the ACA, which aims to prevent health insurance discrimination. An incorrect approach that focuses solely on incentivizing participation in specific, potentially narrow wellness activities without considering broader health education or accessibility fails to address the root causes of healthcare cost escalation. This approach could be ethically problematic if the incentives disproportionately benefit healthier employees, or if the activities are not evidence-based, leading to wasted resources and potential employee dissatisfaction. It also risks violating the ACA's provisions regarding wellness program incentives, which have limitations to prevent discrimination against individuals with disabilities or pre-existing conditions. Another incorrect approach that prioritizes punitive measures for employees who do not participate in wellness programs or who have higher healthcare utilization is ethically unsound and likely violates anti-discrimination laws. Such an approach creates a coercive environment, undermines trust, and can lead to employees avoiding necessary medical care for fear of penalties. This directly contradicts the spirit of promoting employee well-being and can lead to increased long-term healthcare costs due to delayed treatment. A third incorrect approach that relies exclusively on external vendors for all demand management initiatives without internal oversight or integration with the organization's overall health strategy can lead to fragmented and ineffective programs. While vendors can offer expertise, a lack of internal alignment can result in programs that do not address the specific needs of the employee population or that fail to achieve sustainable cost control outcomes. This can also lead to compliance issues if vendor-provided programs do not adhere to all relevant U.S. regulations. The professional decision-making process for similar situations should involve a thorough understanding of the organization's specific healthcare cost drivers, employee demographics, and the relevant regulatory landscape. It requires a strategic approach that prioritizes evidence-based interventions, promotes voluntary participation, ensures equitable access, and fosters a culture of health and well-being. Continuous evaluation of program effectiveness and compliance is essential. Question 7. Risk assessment procedures indicate that a mid-sized hospital is facing significant budget constraints for the upcoming fiscal year. The administration is considering two primary investment opportunities: upgrading its outdated patient monitoring systems in the intensive care unit, ICU, or expanding its community-based chronic disease management program. Both initiatives are deemed important for improving patient outcomes and operational efficiency, but funding is only sufficient for one. The hospital must decide which investment to prioritize, understanding that choosing one will mean forgoing the potential benefits of the other. Which of the following approaches best reflects sound professional judgment in managing this resource allocation challenge, considering the principles of opportunity cost and regulatory expectations for healthcare cost control and quality of care? Option A. Prioritize the expansion of the community-based chronic disease management program, as it addresses a broader population health need and has the potential for significant long-term cost savings through preventative care, aligning with regulatory emphasis on value-based care and population health management. Option B. Defer both investments and maintain the status quo to avoid making a potentially suboptimal decision, preserving the current budget for unforeseen emergencies. Option C. Allocate funds to the initiative that has the most vocal support from influential medical staff, as their buy-in is crucial for successful implementation and patient satisfaction. Option D. Invest in the upgrade of the patient monitoring systems in the ICU, as this directly impacts the most critically ill patients and addresses immediate safety concerns, which are paramount in healthcare. The correct answer is A. Prioritize the expansion of the community-based chronic disease management program, as it addresses a broader population health need and has the potential for significant long-term cost savings through preventative care, aligning with regulatory emphasis on value-based care and population health management. Explanation: this scenario is professionally challenging because it requires a healthcare organization to make a difficult resource allocation decision under financial constraints, directly impacting patient care and operational efficiency. The core of the challenge lies in balancing competing needs and understanding the concept of opportunity cost, the value of the next best alternative foregone when a choice is made. In this context, choosing to invest in one technology or service means foregoing the potential benefits of investing in another. Regulatory frameworks, such as those governing healthcare finance and patient access, often mandate efficient resource utilization and quality of care, making these decisions subject to scrutiny. The correct approach involves a comprehensive evaluation of all potential investments, considering not only their direct costs and anticipated benefits, but also the opportunity cost associated with each choice. This means understanding what is being sacrificed by selecting one option over others. For instance, investing in advanced diagnostic imaging might improve diagnostic accuracy, but could divert funds from essential primary care services or staff training, potentially impacting a broader patient population. A decision guided by a thorough opportunity cost analysis, aligned with the organization's strategic goals and regulatory obligations for patient welfare and financial stewardship, represents best professional practice. This ensures that resources are allocated in a way that maximizes overall value and minimizes negative impacts, adhering to principles of sound financial management and ethical patient care. An incorrect approach would be to prioritize the investment with the most immediate or visible technological advancement without considering the broader implications or the value of the foregone alternatives. For example, selecting a new, expensive electronic health record system solely because it offers cutting-edge features, while neglecting the opportunity to invest in preventative care programs that could yield greater long-term cost savings and improved population health outcomes, would be a failure. This approach ignores the opportunity cost of not investing in preventative care and may violate regulatory expectations for efficient and effective healthcare delivery. Another incorrect approach would be to make the decision based on the loudest stakeholder advocacy or the easiest implementation, without a systematic evaluation of the relative merits and opportunity costs of different options. For instance, approving a costly new surgical suite because a prominent surgeon champions it, without a rigorous assessment of whether those funds could be better used to expand outpatient mental health services, which might address a more pressing community need and offer a higher return on investment in terms of population well-being, would be a significant ethical and financial misstep. This decision-making process fails to consider the opportunity cost of not addressing other critical needs and may not align with the organization's fiduciary responsibilities. Professionals should employ a decision-making framework that begins with clearly defining the problem and the available options. This should be followed by a systematic assessment of each option's costs, benefits, and crucially, its opportunity cost. This analysis should be informed by the organization's strategic objectives, patient needs, and relevant regulatory requirements. Stakeholder input is valuable, but the final decision must be grounded in a data-driven evaluation that prioritizes the greatest overall value and minimizes negative consequences, reflecting a commitment to both financial prudence and patient welfare. Question 8. The efficiency study reveals that a proposed healthcare financing mechanism for a large employer group relies heavily on individual health status underwriting to determine premium contributions, with limited risk adjustment features. Which financing mechanism approach, when considering the regulatory framework for managing health care costs in the United States, best addresses the inherent risks associated with this proposal? Option A. Increasing the proportion of costs borne by the individual through higher deductibles and co-payments. Option B. Utilizing a defined contribution approach with a voucher system for purchasing individual market plans. Option C. Shifting to a fully capitated payment model for all providers. Option D. Implementing a community rating system with a robust risk adjustment program. The correct answer is D. Implementing a community rating system with a robust risk adjustment program. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of how different healthcare financing mechanisms interact with risk assessment, particularly within the specific regulatory framework governing the CEBS exam. The core challenge lies in identifying the financing mechanism that best aligns with the principle of managing financial risk for a defined population, while adhering to the relevant U.S. healthcare regulations. Careful judgment is required to distinguish between mechanisms that effectively pool risk and those that may inadvertently exacerbate it or lead to adverse selection. The correct approach involves selecting the financing mechanism that inherently promotes broad risk pooling and discourages cherry-picking of low-cost individuals. This approach is right because it aligns with the fundamental goals of health insurance and the regulatory intent behind mechanisms designed to ensure access to care and financial stability for a covered population. Specifically, in the U.S. context, mechanisms that involve a large, diverse risk pool, such as those mandated by the Affordable Care Act, ACA, for qualified health plans, are designed to spread the financial burden of healthcare costs across many individuals, thereby reducing the impact of high-cost claimants on any single entity or individual. This aligns with the regulatory emphasis on preventing discrimination based on health status and ensuring that insurance is available and affordable. An incorrect approach would be to favor a financing mechanism that relies heavily on individual underwriting without robust risk adjustment or community rating. This is professionally unacceptable because it can lead to adverse selection, where healthier, lower-cost individuals opt out of coverage, leaving a pool of sicker, higher-cost individuals. This drives up premiums for the remaining participants, potentially making coverage unaffordable and undermining the principle of risk pooling. Such an approach would likely violate U.S. regulations that aim to ensure fair access to insurance and prevent market segmentation based on health status. Another incorrect approach would be to advocate for a financing mechanism that shifts a disproportionate amount of financial risk directly to the patient without adequate safeguards or subsidies. While cost-sharing is a component of many plans, an over-reliance on out-of-pocket expenses can create significant financial barriers to care, particularly for those with chronic conditions or unexpected medical needs. This can lead to delayed or foregone care, resulting in poorer health outcomes and potentially higher long-term costs, which is contrary to the goals of efficient health care financing and may conflict with consumer protection regulations. A third incorrect approach would be to endorse a financing mechanism that lacks transparency in its cost structures and benefit designs. Without clear understanding of how premiums are determined and how costs are allocated, it becomes difficult for stakeholders to make informed decisions and for regulators to ensure fairness and efficiency. This lack of transparency can obscure potential inefficiencies or inequities in the financing system, making it harder to control overall health care costs and potentially violating disclosure requirements under U.S. health care law. The professional decision-making process for similar situations should involve a thorough assessment of the proposed financing mechanism against established principles of risk management, equity, and regulatory compliance. This includes evaluating how the mechanism pools risk, its impact on adverse selection, its transparency, and its alignment with consumer protection laws and the goals of ensuring access to affordable health care. Professionals must prioritize mechanisms that promote a stable and equitable insurance market, as intended by federal and state regulations. Question 9. Market research demonstrates that consumers are increasingly seeking greater transparency regarding the cost of healthcare services and their out-of-pocket expenses. A health plan is considering implementing a new digital platform that provides real-time cost estimates for various medical procedures and allows members to compare provider costs. However, the plan also proposes to increase deductibles and co-insurance for services obtained outside of a preferred provider network, with the stated goal of encouraging cost-conscious decision-making. Which of the following approaches best balances the principles of consumer-directed healthcare with regulatory compliance and ethical considerations in the U.S. healthcare landscape? Option A. Implement the digital platform with real-time cost estimates and provider comparisons, coupled with a robust educational campaign on how to interpret this information and navigate cost-sharing, while ensuring that out-of-network cost-sharing does not create insurmountable barriers to medically necessary care. Option B. Launch the digital platform with detailed cost data and provider ratings. Limit the educational component to basic instructions on accessing the platform, believing that consumers are fully capable of independently interpreting complex financial and clinical information. Option C. Introduce a tiered network system where out-of-network providers face significantly higher cost sharing, and the digital platform only displays the lowest cost in-network options, effectively discouraging any consideration of out-of-network care. Option D. Focus primarily on increasing deductibles and co-insurance for out-of-network services to strongly incentivize members to utilize in-network providers, thereby driving down overall plan costs, and assume consumers will adapt to the transparency tools provided. The correct answer is A. Implement the digital platform with real-time cost estimates and provider comparisons, coupled with a robust educational campaign on how to interpret this information and navigate cost-sharing, while ensuring that out-of-network cost-sharing does not create insurmountable barriers to medically necessary care. Explanation: this scenario is professionally challenging because it requires balancing the goals of consumer empowerment through transparency and cost-sharing, with the potential for unintended consequences that could undermine access to necessary care or lead to adverse health outcomes. The CEBS exam focuses on managing and controlling health care costs within a specific regulatory framework, which in this case we will assume is the United States. Therefore, any analysis must be grounded in U.S. federal and state laws and regulations governing health insurance and consumer protection. The correct approach involves a comprehensive assessment of how a proposed transparency initiative impacts various stakeholder groups, particularly vulnerable populations, and whether it aligns with the principles of consumer-directed healthcare while adhering to regulatory mandates. This includes evaluating the clarity and accessibility of information, the potential for adverse selection or avoidance of care due to cost concerns, and ensuring that cost-sharing mechanisms are designed equitably and do not create undue financial burdens that compromise health. Regulatory frameworks like the Affordable Care Act, ACA and ERISA, Employee Retirement Income Security Act, provide guidelines for plan design, disclosure, and consumer protections that must be considered. Ethical considerations also demand that transparency efforts do not lead to a two-tiered system, where only those who can afford to understand and navigate complex cost information receive adequate care. An incorrect approach would be to solely focus on the cost-saving potential of increased transparency without adequately considering the impact on patient behavior and health outcomes. For instance, simply providing raw cost data without context or tools for comparison might overwhelm consumers, leading to disengagement or poor decision-making. This could violate the spirit of consumer-directed care by making it more difficult, rather than easier, for individuals to make informed choices. Another incorrect approach would be to implement cost-sharing mechanisms that disproportionately burden individuals with chronic conditions or lower incomes, potentially leading to delayed or foregone care, which contravenes the ethical imperative of equitable access and the regulatory intent of many health insurance laws designed to protect individuals from catastrophic health costs. A third incorrect approach might involve a lack of robust consumer education and support alongside transparency tools, leaving individuals ill-equipped to utilize the information effectively, thereby failing to achieve the intended benefits of consumer-directed health care and potentially leading to non-compliance with disclosure requirements. The professional decision-making process for similar situations should involve a multifaceted risk assessment. This includes 1. Identifying all relevant stakeholders and their potential benefits and risks. 2. Thoroughly reviewing applicable U.S. federal and state regulations concerning health insurance, transparency, and consumer protection. 3. Evaluating the proposed initiative against the core principles of consumer-directed healthcare, ensuring it promotes informed decision-making and equitable access. 4. Conducting pilot programs or simulations to gauge consumer understanding and behavioral responses. And 5. Establishing clear metrics for success that go beyond mere cost reduction to include patient satisfaction, adherence to care plans, and health outcomes. Question 10. Research into the impact of chronic conditions on healthcare expenditures has revealed a significant increase in utilization patterns among insured individuals diagnosed with type 2 diabetes. A health insurance provider, aiming to manage rising costs and encourage healthier lifestyle choices, is considering implementing a new policy. This policy would introduce a higher copayment for all prescription medications related to diabetes management and require pre-authorization for all specialist visits specifically for diabetes care. The provider believes this will incentivize members to be more proactive in managing their condition and reduce unnecessary healthcare utilization. Option A. Implement the proposed higher copayments for diabetes medications and the pre-authorization requirement for specialist visits, as these measures are designed to address potential moral hazard and promote cost-effective care management within the regulatory framework for controlling healthcare costs. Option B. Implement the higher copayments and pre-authorization requirements, but waive them for individuals who can demonstrate they are actively participating in a recognized diabetes self-management program to mitigate concerns about access while still addressing cost control. Option C. Reject the proposed policy entirely, arguing that any increase in cost-sharing or utilization management for a chronic condition like diabetes is inherently discriminatory and could lead to adverse selection, thereby violating principles of equitable access to care. Option D. Focus solely on increasing the overall deductible for all policyholders across the board, as this is a broad-based cost control measure that avoids singling out specific conditions or treatments. The correct answer is A. Implement the proposed higher copayments for diabetes medications and the pre-authorization requirement for specialist visits, as these measures are designed to address potential moral hazard and promote cost-effective care management within the regulatory framework for controlling healthcare costs. Explanation. This scenario presents a classic ethical dilemma at the intersection of insurance principles and healthcare cost management, specifically concerning moral hazard and adverse selection. The challenge lies in balancing the insurer's fiduciary duty to manage costs and maintain financial solvency with the ethical obligation to provide necessary care and avoid discriminatory practices. The regulator's focus on controlling healthcare costs, as implied by the exam's title, adds a layer of compliance pressure. The correct approach involves a nuanced understanding of how to mitigate moral hazard without unduly penalizing individuals for seeking legitimate medical care. This requires implementing cost-sharing mechanisms that are actuarially sound and transparent, ensuring that individuals have a financial stake in their healthcare decisions without creating a barrier to essential treatment. Regulatory frameworks often permit such mechanisms as a means of controlling utilization and promoting efficiency. The ethical justification stems from the principle of fairness and the need to maintain a sustainable insurance market. An incorrect approach would be to implement broad, arbitrary exclusions or significant, non-transparent increases in deductibles and copayments for specific conditions without a clear actuarial basis. This could lead to adverse selection, where individuals with higher anticipated healthcare needs are disproportionately affected, potentially driving up premiums for everyone or leading to market withdrawal. Ethically, such actions could be seen as discriminatory and a failure to uphold the principle of equitable access to care. Another incorrect approach would be to ignore the potential for moral hazard altogether, leading to unchecked utilization and unsustainable cost increases, which would ultimately harm the long-term viability of the insurance plan and potentially violate regulatory mandates for cost control. The professional decision-making process should involve a thorough analysis of the specific risks and costs associated with the condition in question, consultation with actuarial experts, and a review of relevant regulatory guidance on cost-sharing and benefit design. It requires a commitment to transparency with policyholders about the rationale behind any changes to coverage or cost-sharing. Professionals must weigh the financial implications against the ethical considerations of access to care and fairness, always striving for solutions that are both compliant and equitable. Question 11. To address the challenge of ensuring participants effectively utilize their flexible spending accounts, FSA, and minimize forfeitures due to administrative inefficiencies, which of the following process optimization strategies would best align with regulatory expectations for health plan management? Option A. Restricting claim submission to a single, paper-based method with limited office hours for inquiries. Option B. Directing all participant inquiries about eligible expenses to generic, unsearchable online FAQs without providing alternative support. Option C. Sending a single, year-end notification detailing remaining FSA balances and the deadline for claim submission. Option D. Implementing a multi-channel system for participants to check balances and submit claims, supported by readily available educational resources on eligible expenses and claim procedures. The correct answer is D. Implementing a multi-channel system for participants to check balances and submit claims, supported by readily available educational resources on eligible expenses and claim procedures. Explanation. This scenario is professionally challenging because it requires balancing the administrative efficiency of a health plan with the legal and ethical obligations to ensure participants fully understand and can utilize their flexible spending accounts. FSA. The use it or lose it nature of FSAs, while a core feature, can lead to participant frustration and potential financial loss if not managed with clear communication and accessible processes. The challenge lies in optimizing the administrative process without compromising participant rights or regulatory compliance. The correct approach involves proactive communication and accessible self-service tools. This aligns with the regulatory framework governing health plans, which emphasizes participant education and access to information. Specifically, under U.S. Department of Labor (DOL) and Internal Revenue Service (IRS) guidelines, plan sponsors have a fiduciary responsibility to act in the best interest of participants. This includes providing clear and timely information about plan benefits and how to access them, offering multiple channels for checking balances and submitting claims, along with educational resources on eligible expenses, directly supports this responsibility. It empowers participants to make informed decisions and maximize their benefits, thereby optimizing the FSA program's effectiveness and participant satisfaction. An incorrect approach would be to rely solely on year-end notifications of remaining balances. This fails to meet the regulatory expectation of ongoing, accessible information. Participants are unlikely to recall or effectively act on a single notification late in the plan year, leading to forfeiture of funds and potential dissatisfaction. This approach also neglects the ethical obligation to facilitate participant benefit utilization. Another incorrect approach would be to limit claim submission to a single, paper-based method with restricted office hours. This creates an unnecessary barrier to access, particularly for participants with busy schedules or limited access to physical mail. It is not aligned with the spirit of providing flexible benefits and can be seen as an administrative hurdle rather than a supportive process, potentially violating the principle of reasonable access to plan benefits. Finally, an approach that discourages participants from inquiring about eligible expenses by directing them to generic, unhelpful online FAQs would also be professionally unacceptable. While directing to FAQs is common, the failure to provide clear, specific guidance or alternative contact methods for complex queries demonstrates a lack of commitment to participant understanding and benefit maximization. This can lead to confusion and missed opportunities to use FSA funds appropriately, undermining the purpose of the benefit. The professional decision-making process for similar situations should involve a continuous assessment of participant needs and regulatory requirements. This includes regularly reviewing communication strategies, claim submission processes, and available support channels to ensure they are clear, accessible, and compliant. A proactive, participant-centric approach that prioritizes education and ease of use is paramount. Question 12. Analysis of a healthcare organization's administrative overhead reveals that its billing and compliance departments consume a significant portion of its operating budget. The organization is exploring strategies to reduce these costs while ensuring continued adherence to all relevant federal and state regulations governing healthcare billing and compliance. Which of the following approaches best balances cost reduction with regulatory integrity? Option A. Implementing advanced claims management software to automate submission, track denials, and facilitate appeals, coupled with a robust, ongoing staff training program on current billing codes and compliance mandates. Option B. Adopting a policy of only addressing compliance issues when they are identified through external audits or regulatory inquiries. Option C. Introducing a series of complex, multi-level approval processes for all billing-related documentation to ensure thoroughness. Option D. Significantly reducing the number of personnel in the billing and compliance departments to cut direct labor costs. The correct answer is A. Implementing advanced claims management software to automate submission, track denials, and facilitate appeals, coupled with a robust, ongoing staff training program on current billing codes and compliance mandates. Explanation. This scenario presents a professional challenge because it requires a healthcare organization to balance the imperative of efficient and compliant billing practices with the potential for administrative overhead to inflate costs. The organization must navigate complex regulatory requirements for billing and compliance, such as those mandated by the Centers for Medicare and Medicaid Services, CMS, in the United States, while simultaneously seeking to control operational expenses. The tension lies in ensuring that robust compliance measures, which are essential to avoid penalties and maintain program integrity, do not become an undue financial burden on the organization or, by extension, on the healthcare system through inflated costs. Careful judgment is required to identify and implement strategies that optimize administrative processes without compromising regulatory adherence or patient care. The correct approach involves a proactive and integrated strategy for managing administrative overhead. This includes leveraging technology for automated claims processing and denial management, implementing robust internal audit programs to identify and rectify billing errors before submission, and investing in ongoing staff training to ensure up-to-date knowledge of billing codes and compliance regulations. This approach is professionally sound because it directly addresses the root causes of high administrative costs by improving efficiency and reducing rework, while simultaneously strengthening compliance. For instance, automated claims processing reduces manual errors and speeds up reimbursement, thereby lowering the cost per claim. Regular audits and training ensure adherence to regulations like the False Claims Act and HIPAA, mitigating the risk of costly fines and reputational damage. This aligns with the overarching goal of managing healthcare costs by optimizing administrative functions. An incorrect approach would be to simply reduce staffing in billing and compliance departments without a corresponding improvement in processes or technology. This could lead to increased errors, delayed claims, and a higher likelihood of noncompliance, ultimately increasing administrative costs through rework, penalties, and potential loss of revenue. Such a strategy fails to recognize that administrative overhead is not solely a function of headcount, but also of process efficiency and technological utilization. Another incorrect approach would be to adopt a reactive stance, only addressing compliance issues when they are flagged by external auditors or regulators. This approach is costly and inefficient, as it often involves significant remediation efforts and penalties after the fact. It also fails to proactively identify and correct systemic issues that contribute to high administrative overhead. A third incorrect approach would be to implement overly complex and bureaucratic internal controls that hinder the efficiency of the billing process without a clear correlation to improved compliance outcomes. While controls are necessary, they must be streamlined and effective, not burdensome. This can lead to increased administrative time and resources spent on internal processes, thereby inflating overhead without a commensurate benefit in cost control or compliance. The professional decision-making process for similar situations should involve a comprehensive assessment of current administrative processes, identifying bottlenecks and areas of inefficiency. This should be followed by an evaluation of technological solutions and best practices in billing and compliance management. A cost-benefit analysis of proposed changes, considering both financial implications and regulatory risks, is crucial. Furthermore, continuous monitoring and evaluation of administrative overhead and compliance metrics are essential to ensure ongoing optimization and adherence to evolving regulatory landscapes. Question 13. The investigation demonstrates that a hospital is considering adopting a new, innovative surgical technique for a common procedure. While the new technique promises a faster recovery time and a lower rate of post-operative complications, its initial cost per procedure is significantly higher than the current standard surgical method. The hospital's finance department is concerned about the immediate budgetary impact, while the surgical department highlights the potential for improved patient outcomes and reduced readmission rates. Which of the following approaches best reflects the principles of managing and controlling health care costs within the U.S. regulatory framework, considering both financial and clinical implications? Option A. Implement the new surgical technique without a thorough evaluation, assuming that any innovation will automatically lead to better cost-effectiveness and patient care. Option B. Focus exclusively on the direct procedural costs, disregarding any potential downstream savings or improvements in patient well-being, to ensure the lowest possible expenditure per surgery. Option C. Reject the new surgical technique solely based on its higher upfront cost per procedure, prioritizing immediate cost containment over potential long-term benefits and patient outcomes. Option D. Conduct a comprehensive marginal analysis to compare the incremental costs and benefits of the new surgical technique against the existing standard, factoring in potential long-term savings from reduced complications and readmissions, as well as improvements in patient quality of life. The correct answer is D. Conduct a comprehensive marginal analysis to compare the incremental costs and benefits of the new surgical technique against the existing standard, factoring in potential long-term savings from reduced complications and readmissions, as well as improvements in patient quality of life. Explanation. This scenario presents a common challenge in healthcare cost management, deciding whether to adopt a new, potentially more effective, but initially more expensive treatment. The core of the decision lies in understanding marginal analysis, evaluating the incremental costs and benefits of the new treatment compared to the existing standard of care. Professionals must balance financial stewardship with the ethical imperative to provide the best possible patient outcomes. The challenge is amplified by the need to adhere strictly to U.S. regulatory frameworks governing healthcare spending and evidence-based practice, such as those influenced by Medicare and Medicaid guidelines, and the principles of value-based purchasing. The correct approach involves a thorough marginal analysis that considers not only direct medical costs, but also potential downstream savings, e.g., reduced hospitalization, improved productivity, and patient quality of life improvements. This aligns with the principles of cost-effectiveness and efficiency mandated by U.S. healthcare regulations, which encourage the adoption of interventions that offer the greatest health benefit for the resources expended. It also reflects the ethical obligation to patients to utilize resources wisely to maximize overall population health. An incorrect approach would be to solely focus on the immediate, higher upfront cost of the new treatment, without considering its long-term benefits or potential cost offsets. This fails to adhere to the spirit of cost-effectiveness and can lead to suboptimal resource allocation, potentially denying patients access to more beneficial treatments in the long run. Another incorrect approach would be to dismiss the new treatment based on anecdotal evidence or physician preference without a systematic evaluation of its marginal impact. This disregards the evidence-based decision-making principles that underpin effective healthcare cost control and patient care quality. Finally, an approach that prioritizes cost reduction above all else, even at the expense of demonstrably better patient outcomes, would be ethically and regulatorily unsound, as it fails to uphold the primary goal of healthcare provision. Professionals should approach such decisions by establishing a clear framework for evaluating new treatments. This framework should include 1. Identifying all relevant incremental costs and benefits, both financial and clinical. 2. Assessing the strength of evidence supporting the new treatment's efficacy and cost-effectiveness. 3. Considering the impact on patient populations and overall healthcare system sustainability. And 4. Consulting relevant regulatory guidelines and ethical principles. This systematic process ensures that decisions are data-driven, ethically sound, and compliant with regulatory requirements. Question 14. During the evaluation of an employer's current health insurance plan, a benefits manager identifies potential cost savings by reducing the scope of covered services and increasing employee deductibles and co-pays. The manager is considering implementing these changes to lower the overall premium paid by the employer, without a detailed analysis of whether the revised plan would still meet the Affordable Care Act's minimum value and affordability standards for its full-time employees. Which of the following approaches represents the most appropriate course of action for the benefits manager? Option A. Eliminate employer-sponsored health insurance entirely and advise employees to seek coverage through the individual market, as this is a simpler way to manage costs. Option B. Implement the cost-saving measures by selectively excluding certain ACA-mandated essential health benefits from the plan, believing these specific benefits are optional for employer-sponsored plans. Option C. Proceed with the cost-saving measures immediately to reduce the employer's financial burden, assuming that any plan offered by an employer is inherently compliant as long as it provides some level of coverage. Option D. Conduct a thorough review to ensure the proposed changes align with the Affordable Care Act's minimum value and affordability requirements, and consult with legal counsel and benefits advisors to confirm compliance before implementation. The correct answer is D. Conduct a thorough review to ensure the proposed changes align with the Affordable Care Act's minimum value and affordability requirements, and consult with legal counsel and benefits advisors to confirm compliance before implementation. Explanation. This scenario is professionally challenging because it requires navigating the complex interplay between employer responsibilities, employee rights, and the regulatory landscape governing private health insurance in the United States, specifically under the framework relevant to the CEBS exam. The core challenge lies in ensuring compliance with the Affordable Care Act, ACA, and other applicable federal and state laws, while managing the financial implications of offering health benefits. Employers must balance the cost of coverage with the need to provide adequate and compliant health insurance options to their employees. The decision-making process demands a thorough understanding of legal requirements, ethical considerations regarding employee well-being, and the practicalities of plan administration. The correct approach involves a comprehensive review of the employer's current health insurance plan against the ACA's employer shared responsibility provisions and essential health benefits requirements. This includes verifying that the plan offers minimum value coverage and is affordable for the majority of full-time employees. This approach is correct because it directly addresses the employer's legal obligations to provide compliant health coverage, thereby avoiding penalties and ensuring employees have access to necessary care. Adhering to these regulations is paramount for ethical operation and demonstrates a commitment to employee welfare, which is a cornerstone of responsible employer-sponsored health insurance management. An incorrect approach that focuses solely on cost reduction by significantly narrowing the network of providers without a corresponding increase in affordability or essential health benefits would be professionally unacceptable. This fails to meet the ACA's requirements for minimum value and affordability, potentially exposing the employer to penalties. Ethically, it compromises employee access to care and places a disproportionate burden on employees to seek out-of-network care, which is often more expensive and may not be covered. Another incorrect approach that involves discontinuing employer-sponsored health insurance altogether without first exploring all compliant alternatives, such as offering a qualified health plan through the health insurance marketplace with a qualified small employer health reimbursement arrangement, QSERA, or Small Business Health Options Program, SHOP, marketplace options where applicable, would also be problematic. While technically an option for some employers, this can lead to employees facing higher individual premiums and potentially less comprehensive coverage, and it may not fully satisfy the employer's responsibility to offer coverage if they are considered a large employer. Furthermore, it can negatively impact employee morale and retention. A third incorrect approach that involves cherry-picking specific ACA-mandated benefits to exclude from the plan, believing they are optional, is a direct violation of federal law. This demonstrates a fundamental misunderstanding of the ACA's requirements and would lead to non-compliance, significant penalties, and potential legal challenges. The professional decision-making process for similar situations should begin with a thorough understanding of all applicable federal and state regulations, particularly the ACA. Employers should consult with benefits advisors and legal counsel to ensure their plan design and administration are compliant. Regular reviews of plan performance, cost trends, and regulatory updates are essential. When considering changes, the primary focus should always be on maintaining compliance while striving for cost effectiveness and ensuring employees have access to quality, affordable health care. A proactive approach to understanding and meeting these obligations is key to responsible health benefit management. Question 15. Compliance review shows that a health plan's member satisfaction scores are significantly lower among individuals residing in lower-income zip codes and those who have indicated limited English proficiency. The plan's current communication strategy relies primarily on written materials mailed to members' homes and a standard website portal for accessing information and scheduling appointments. What is the most appropriate course of action for the health plan to address these disparities in access and understanding? Option A. Advise members with limited English proficiency to utilize translation services available through their personal devices and encourage all members to visit the website for the most up-to-date information. Option B. Develop and implement a multi-channel outreach program that includes culturally and linguistically appropriate educational materials, phone-based support in multiple languages, and community-based navigators to assist members with understanding benefits and accessing care. Option C. Increase the frequency of mailed newsletters to all members, assuming that broader distribution will eventually reach those who need it most. Option D. Focus on improving the website's search functionality and user interface, assuming that technological advancements will naturally bridge communication gaps. The correct answer is B. Develop and implement a multi-channel outreach program that includes culturally and linguistically appropriate educational materials, phone-based support in multiple languages, and community-based navigators to assist members with understanding benefits and accessing care. Explanation: this scenario is professionally challenging because it requires balancing the operational efficiency of a health plan with its ethical and regulatory obligations to serve all members equitably, particularly those facing socioeconomic disparities. The health plan must proactively address barriers to care stemming from socioeconomic factors and health literacy, rather than passively waiting for members to overcome them independently. This requires a nuanced understanding of how these disparities impact health outcomes and access to services. The correct approach involves implementing targeted outreach and education programs designed to address the specific barriers faced by members with lower socioeconomic status and limited health literacy. This aligns with the principles of equitable access to care, which is a fundamental tenet of health plan regulation and ethical healthcare delivery. Such programs demonstrate a commitment to member well-being beyond simply providing a benefits package, actively working to ensure members can effectively utilize their benefits. This proactive stance is often implicitly or explicitly supported by regulations aimed at preventing discrimination and promoting health equity. An incorrect approach would be to assume that all members have equal capacity to navigate the healthcare system or understand complex health information. This overlooks the reality of socioeconomic disparities and health literacy challenges, leading to a de facto denial of care for vulnerable populations, relying solely on standard communication methods without considering accessibility for individuals with limited literacy or digital access, fails to meet the obligation to provide understandable information and facilitate access. This can lead to regulatory noncompliance, as it may be interpreted as discriminatory or failing to meet member service standards. Another incorrect approach is to delegate the responsibility for overcoming these barriers entirely to the member. While member engagement is important, a health plan has a responsibility to provide reasonable support and accommodations. Shifting the burden of overcoming systemic disadvantages to the individual member is ethically questionable and can lead to significant health disparities, potentially violating regulations that mandate efforts to ensure access and understanding. The professional decision-making process for similar situations should involve a framework that prioritizes understanding the diverse needs of the member population. This includes 1. Identifying vulnerable populations and potential barriers to care based on socioeconomic factors and health literacy. 2. Assessing the effectiveness of current communication and outreach strategies in reaching these populations. 3. Developing and implementing targeted interventions, such as culturally sensitive educational materials, multilingual support, and accessible communication channels. 4. Regularly evaluating the impact of these interventions and making adjustments as needed. 5. Ensuring that all actions are compliant with relevant federal and state regulations concerning non-discrimination, member rights, and access to care. Question 16. The audit findings indicate that the increasing cost of specialized healthcare services in a particular metropolitan area is significantly influenced by a demonstrable shortage of qualified oncologists and advanced practice nurses, leading to longer patient wait times and higher per-service labor expenses. Considering the regulatory framework governing healthcare in the United States, which of the following approaches best addresses this situation while ensuring compliance and ethical patient care? Option A. Immediately implement a hiring freeze for all specialized healthcare professionals and mandate a reduction in the number of patient appointments scheduled per day to control labor expenditures, regardless of the impact on patient access or wait times. Option B. Attribute the rising costs solely to provider inefficiency and impose significant financial penalties on healthcare facilities that exceed a predetermined cost benchmark, without investigating the underlying labor market dynamics or staffing challenges. Option C. Develop and implement a regional workforce development initiative in partnership with local medical schools and nursing programs to increase the pipeline of oncologists and advanced practice nurses, while simultaneously exploring innovative care coordination models that optimize the utilization of existing specialized staff and advocating for reimbursement policies that reflect the true cost of specialized care. Option D. Reduce the scope of oncology services offered by healthcare facilities in the region and encourage patients to seek care in more distant, less specialized facilities to alleviate local labor pressures and associated costs. The correct answer is C. Develop and implement a regional workforce development initiative in partnership with local medical schools and nursing programs to increase the pipeline of oncologists and advanced practice nurses, while simultaneously exploring innovative care coordination models that optimize the utilization of existing specialized staff and advocating for reimbursement policies that reflect the true cost of specialized care. Explanation: the audit findings indicate a potential imbalance in the supply and demand for specialized healthcare labor within a specific region, leading to increased costs for healthcare services. This scenario is professionally challenging because it requires a nuanced understanding of market dynamics within the highly regulated healthcare sector, balancing cost containment with the imperative to ensure access to quality care and maintain a competent workforce. Professionals must navigate the complexities of physician and nurse shortages, geographic maldistribution, and the impact of reimbursement policies on labor supply and demand. The correct approach involves analyzing the root causes of the labor imbalance and its impact on healthcare costs through a lens that prioritizes patient access and quality of care, while adhering to relevant U.S. federal and state regulations governing healthcare labor and reimbursement. This includes understanding how Medicare and Medicaid reimbursement rates, as well as private payer negotiations, influence provider staffing decisions and the overall cost structure of healthcare services. The approach should also consider the ethical obligation to ensure adequate staffing levels to prevent burnout and maintain patient safety, as mandated by various professional standards and potentially state licensing boards. This involves a proactive strategy of workforce planning, potentially including partnerships with educational institutions to increase the pipeline of qualified professionals, exploring innovative care delivery models that optimize existing labor, and advocating for policy changes that address systemic issues contributing to shortages and cost inflation. An incorrect approach would be to solely focus on reducing labor costs by limiting wage increases or reducing staffing ratios without a comprehensive analysis of the impact on service availability and quality. This would likely violate ethical obligations to patients and could lead to noncompliance with staffing mandates or quality standards set by regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, or state health departments. Such an approach could also exacerbate existing labor shortages, further driving up costs through increased reliance on expensive temporary staffing or by forcing patients to seek care elsewhere, potentially in less efficient settings. Another incorrect approach would be to ignore the supply and demand dynamics and attribute cost increases solely to provider inefficiency. While efficiency is important, failing to acknowledge the impact of labor market forces, such as a scarcity of specialized physicians or nurses in a particular area, on the cost of services is a significant oversight. This could lead to misguided cost containment strategies that do not address the underlying market issues and may even be counterproductive. For instance, implementing punitive measures against providers without understanding the labor market realities could lead to further attrition of skilled professionals, worsening the problem. A third incorrect approach would be to implement broad, across-the-board cuts to service offerings without considering the specific impact on areas where labor supply is already constrained. This could disproportionately affect patient access to essential services and may not align with the goals of managing healthcare costs effectively, as it could lead to increased utilization of more expensive emergency services or delayed care with worse outcomes. This also fails to consider the regulatory requirements for providing certain essential services. The professional decision-making process for similar situations should begin with a thorough data-driven assessment of the labor market dynamics and their correlation with healthcare costs. This involves consulting with stakeholders, including healthcare providers, administrators, and potentially labor representatives, to understand the challenges from multiple perspectives. The next step is to identify potential solutions that are both cost-effective and compliant with all applicable U.S. federal and state regulations, including those related to reimbursement, labor practices, and patient care standards. Ethical considerations, particularly regarding patient access and quality of care, must be paramount throughout the decision-making process. Finally, a continuous monitoring and evaluation framework should be established to assess the effectiveness of implemented strategies and make necessary adjustments. Question 17. Comparative studies suggest that robust formulary management and generic substitution programs can significantly impact healthcare costs. A health plan is reviewing its current pharmacy benefit management (PBM) policies to enhance cost control, Which of the following approaches best aligns with regulatory compliance and professional best practices for managing healthcare costs through these mechanisms? Option A. Focus formulary development on excluding high-cost specialty drugs entirely, regardless of their clinical benefit, and permit pharmacists to substitute any available generic drug for a prescribed brand, even if it differs in inactive ingredients or formulation. Option B. Develop a formulary that prioritizes clinical effectiveness, safety, and cost-effectiveness, supported by transparent evidence-based decision-making, and implement a generic substitution policy that adheres to state laws and professional standards, including a clear process for dispensing interchangeable generics and managing member/physician requests for brand-name drugs when medically appropriate. Option C. Implement a formulary that heavily favors lower-cost drugs, with a strict prior authorization process for all drugs not on the lowest tier, and mandate generic substitution unless a physician explicitly requests a brand name with a documented medical necessity. Option D. Design a formulary based primarily on negotiated rebates, with limited clinical review, and allow pharmacists to substitute generics only if they are identical in active ingredient and dosage form to the prescribed brand, without considering therapeutic equivalence. The correct answer is C. Implement a formulary that heavily favors lower-cost drugs, with a strict prior authorization process for all drugs not on the lowest tier, and mandate generic substitution unless a physician explicitly requests a brand name with a documented medical necessity. Explanation: this scenario is professionally challenging because it requires a health plan to balance cost containment strategies with ensuring patient access to medically necessary medications, all while adhering to specific regulatory requirements. The core tension lies in the potential for formulary design and generic substitution policies to inadvertently create barriers to care or violate patient protections. Careful judgment is required to ensure that cost-saving measures do not compromise the quality or accessibility of covered benefits. The correct approach involves developing and implementing formulary management and generic substitution policies that are transparent, evidence-based, and compliant with all applicable regulations. This includes ensuring that formulary decisions are based on clinical efficacy, safety, and cost-effectiveness, and that mechanisms are in place for exceptions and appeals. Generic substitution must be performed in accordance with state laws and professional pharmacy standards, prioritizing patient safety and therapeutic equivalence. This approach is correct because it directly addresses the regulatory mandate to manage healthcare costs while upholding the plan's fiduciary responsibility to its members and adhering to legal requirements for drug substitution and formulary transparency. An incorrect approach that relies solely on aggressive formulary tiering, without adequate clinical justification or exception processes, would fail to meet regulatory standards for benefit adequacy and could lead to adverse patient outcomes. This would be a regulatory failure, as it might violate provisions requiring access to medically necessary drugs. Another incorrect approach that permits generic substitution without verifying therapeutic equivalence or adhering to state-specific substitution laws would pose a significant patient safety risk and violate professional pharmacy practice standards, leading to potential legal and ethical repercussions. A third incorrect approach that lacks transparency in formulary design, failing to clearly communicate drug coverage and potential out-of-pocket costs to members, would violate disclosure requirements and erode member trust. Professionals should employ a decision-making framework that prioritizes regulatory compliance, clinical evidence, and member well-being. This involves a thorough understanding of the specific laws and guidelines governing pharmacy benefit management in their jurisdiction, including formulary requirements, drug substitution laws, and patient access provisions. They should also consider ethical principles related to patient care and transparency. When developing or reviewing policies, a multidisciplinary approach involving clinicians, pharmacists, legal counsel, and member advocates can help identify potential risks and ensure that strategies are both cost-effective and compliant. Question 18. Benchmark analysis indicates that a state is considering how to best manage its budget implications following the implementation of Medicaid expansion under the Affordable Care Act. The state's finance department has proposed several strategies for allocating costs associated with the newly eligible population. Which of the following strategies most accurately reflects the federal regulatory framework for Medicaid expansion funding and process optimization? Option A. Utilize state general funds to cover the portion of costs for the expansion population that is eligible for enhanced federal matching, thereby creating a dedicated state funding stream. Option B. Limit the scope of services covered for the expansion population to those with the lowest state cost-sharing requirements, even if it means providing less comprehensive care than for other Medicaid beneficiaries. Option C. Apply the state's standard FMAP to all Medicaid beneficiaries, including those newly eligible through expansion, to ensure consistent budget allocation across all recipient groups. Option D. Accurately calculate and claim the Enhanced Federal Medical Assistance Percentage, FMAP, for individuals eligible solely due to Medicaid expansion, ensuring these costs are primarily covered by federal funds as stipulated by the ACA. Correct answer is D. Accurately calculate and claim the Enhanced Federal Medical Assistance Percentage, FMAP, for individuals eligible solely due to Medicaid expansion, ensuring these costs are primarily covered by federal funds as stipulated by the ACA. Explanation. This scenario is professionally challenging because it requires navigating the complex interplay between federal and state responsibilities in Medicaid funding and coverage, particularly in the context of expansion. The Affordable Care Act, ACA, significantly altered the landscape of Medicaid eligibility and funding, and understanding these nuances is crucial for effective cost management and ensuring access to care. The core challenge lies in accurately interpreting and applying the ACA's provisions regarding the Federal Medical Assistance Percentage, FMAP, for expanded Medicaid populations and understanding the state's fiscal responsibilities. The correct approach involves accurately calculating the enhanced FMAP for individuals who become eligible solely due to the Medicaid expansion. This means recognizing that the federal government covers a higher percentage of the costs for these newly eligible individuals, which directly impacts a state's budget and its ability to control healthcare costs. This approach is correct because it aligns with the explicit provisions of the ACA, which established a sliding scale of enhanced FMAP rates for states that expand Medicaid eligibility, with the federal government initially covering 100% of the costs for the expansion population, and gradually decreasing this to 90% by 2020 and thereafter. Adhering to these federal matching rates is a fundamental regulatory requirement for states participating in Medicaid and is essential for accurate financial planning and cost control. An incorrect approach would be to assume that the standard FMAP applies to all Medicaid beneficiaries, including those newly eligible through expansion. This fails to acknowledge the ACA's specific provisions for enhanced federal funding for the expansion population, leading to an underestimation of federal contributions and an overestimation of state expenditures. This represents a regulatory failure, as it misinterprets the ACA's funding mechanisms. Another incorrect approach would be to allocate state general funds to cover the portion of costs that are actually covered by the enhanced FMAP for the expansion population. This is a fiscal mismanagement and regulatory failure because it unnecessarily burdens the state budget by failing to leverage available federal funds as intended by the ACA. It demonstrates a lack of understanding of the federal-state partnership in Medicaid financing. A third incorrect approach would be to limit coverage for the expansion population to services that are not fully reimbursed by the enhanced FMAP, thereby creating a disparity in care access. This is both a regulatory and ethical failure. It is a regulatory failure because it may violate the ACA's requirements for comprehensive coverage for the expansion population, and it is an ethical failure as it creates inequitable access to healthcare services based on eligibility pathway, contradicting the fundamental goals of Medicaid. The professional decision-making process for similar situations should involve a thorough review of the relevant federal legislation, ACA, and its implementing regulations, as well as state-specific Medicaid statutes and policies. Professionals must consult official guidance from the Centers for Medicare and Medicaid Services, CMS, and relevant state agencies. They should prioritize understanding the specific FMAP rates applicable to different eligibility groups, particularly the enhanced rates for the ACA expansion population. This requires a commitment to continuous learning and staying updated on legislative changes and regulatory interpretations. When in doubt, seeking clarification from legal counsel or subject matter experts specializing in Medicaid law and finance is essential. Question 19. Investigation of an employer's proposed wellness program design reveals a plan to offer a significant financial incentive for employees to complete a health risk assessment, HRA, and participate in recommended health-related activities. However, the program also includes a substantial surcharge on health insurance premiums for employees who do not complete the HRA within the specified timeframe. What is the most compliant approach to implementing this wellness program under U.S. federal regulations? Option A. Offer a modest incentive for completing the HRA and participating in activities, and provide a reasonable alternative standard for individuals for whom it is medically inadvisable to participate in the prescribed wellness activities. Option B. Offer a large financial incentive for completing the HRA, making it financially difficult for employees to decline participation. Option C. Require all employees to complete the HRA as a condition of enrollment in the employer-sponsored health plan. Option D. Implement a significant surcharge on health insurance premiums for employees who do not complete the HRA, as this strongly encourages participation. Correct answer is A. Offer a modest incentive for completing the HRA and participating in activities, and provide a reasonable alternative standard for individuals for whom it is medically inadvisable to participate in the prescribed wellness activities. Explanation. This scenario presents a common implementation challenge for wellness programs within the U.S. regulatory framework governing health insurance and employer-sponsored benefits. The core challenge lies in balancing the employer's desire to encourage employee participation in wellness activities and health risk assessments, HRA, with the legal requirements designed to protect individuals from discrimination based on health status. Specifically, the Affordable Care Act, ACA, and related regulations place strict limits on the extent to which employers can incentivize or penalize participation in wellness programs, particularly when those programs involve collecting health information. The goal is to ensure that wellness programs are truly voluntary and do not lead to adverse financial consequences for employees who choose not to participate or who have pre-existing health conditions. The correct approach involves designing a wellness program that offers incentives for participation in activities, such as completing an HRA, but ensures that the incentives are not so substantial as to be coercive. Furthermore, it must provide a reasonable alternative standard for individuals for whom it is medically inadvisable to participate in the prescribed wellness activity. This aligns with ACA provisions that permit wellness program incentives up to 30% of the cost of coverage, or 50% for programs aimed at smoking cessation, and require the availability of reasonable alternatives. This approach respects individual autonomy and protects against discrimination, while still allowing employers to promote healthier lifestyles. An incorrect approach would be to impose a significant financial penalty, such as a substantial increase in health insurance premiums, for failing to complete an HRA or achieve certain health outcomes. This would likely be viewed as coercive and discriminatory, violating ACA provisions that prohibit programs from requiring individuals to attain a particular health status as a condition of receiving a reward. Another incorrect approach would be to offer a very large incentive for participation that effectively makes it financially prohibitive for employees to opt out, thereby undermining the voluntary nature of the program. This could also be seen as a de facto penalty for non-participation. Finally, failing to offer a reasonable alternative for individuals for whom participation is medically inadvisable would also be a regulatory failure, as it does not accommodate all employees and could lead to discrimination claims. Professional decision-making in such situations requires a thorough understanding of the ACA's non-discrimination rules for wellness programs, including the limits on incentives and the requirement for reasonable alternatives. Employers and plan sponsors must consult with legal counsel and benefits experts to ensure their program design complies with these complex regulations. The focus should always be on promoting health and well-being in a manner that is inclusive, voluntary, and non-punitive. Question 20. Cost-benefit analysis shows that implementing a tiered network structure that significantly limits access to certain specialists for a substantial portion of the insured population could reduce overall claims costs. However, this approach raises concerns about potential violations of federal healthcare regulations. Which of the following strategies best aligns with managing healthcare costs while adhering to the legal and regulatory environment. Option A. Conduct a comprehensive legal review to ensure the tiered network design complies with all applicable federal mandates, including non-discrimination provisions and requirements for access to essential health benefits, and explore alternative cost containment strategies that do not compromise regulatory compliance. Option B. Modify the tiered network to exclude coverage for specific high-cost medical procedures, thereby reducing overall claims without directly impacting provider access. Option C. Proceed with the tiered network implementation as planned, assuming that any cost savings achieved will outweigh potential regulatory challenges, and address any compliance issues reactively if they arise. Option D. Focus solely on increasing member cost sharing through higher deductibles and co-pays, as this is a direct method of cost control that is generally permissible under federal law. The correct answer is A. Conduct a comprehensive legal review to ensure the tiered network design complies with all applicable federal mandates, including non-discrimination provisions and requirements for access to essential health benefits, and explore alternative cost containment strategies that do not compromise regulatory compliance. Explanation: this scenario is professionally challenging because it requires navigating complex legal and regulatory mandates within the U.S. healthcare system, specifically concerning the Affordable Care Act, ACA, and its implications for health insurance plan design and cost control. The pressure to reduce costs must be balanced against strict compliance requirements designed to ensure patient access and protect consumers. A failure to adhere to these mandates can result in significant financial penalties, reputational damage, and legal action. The correct approach involves a thorough review of the ACA's provisions, particularly those related to essential health benefits, (ABE), and non-discrimination rules, to ensure any proposed cost-saving measures do not inadvertently violate these federal requirements. This approach prioritizes legal compliance and patient protection, recognizing that short-term cost savings achieved through regulatory noncompliance are unsustainable and detrimental in the long run. The justification lies in the ACA's explicit mandates that plans must cover EHBs and cannot discriminate based on health status or other protected characteristics. Any strategy that circumvents these protections, even if appearing cost-effective on paper, would be a direct violation. An incorrect approach that focuses solely on reducing benefits without a comprehensive legal review risks violating the ACA's EHB requirements. For example, removing certain preventive services or limiting coverage for specific treatments could be deemed non-compliant if those services are considered EHBs. Another incorrect approach might involve designing plan tiers or networks in a way that indirectly discourages enrollment for individuals with pre-existing conditions or high healthcare needs, which could violate non-discrimination provisions. A third incorrect approach could be to implement cost-sharing mechanisms that are disproportionately burdensome on certain patient populations without a clear, legally defensible rationale, potentially leading to accusations of discrimination. Professionals should employ a decision-making framework that begins with identifying all relevant federal and state regulations impacting health insurance plan design and cost control. This includes a deep understanding of the ACA, ERISA, and any state-specific mandates. The next step is to evaluate proposed cost-saving strategies against these regulatory frameworks, seeking legal counsel when necessary. The process should involve a risk assessment to identify potential compliance issues and develop mitigation strategies. Ultimately, the decision should be guided by a commitment to both cost-effectiveness and unwavering adherence to legal and ethical obligations.